Welcome again to the Health Education with MKO Abimbola. Today we will talk about the basics of prostate cancer. And this health education will be dedicated to the loving memory of Alhaji Imrain Abimbola, the father of Dr. MKO Abimbola. Alhaji Abimbola passed away in 2006 after battling prostate cancer. Continue to rest in peace, Baba, as we fondly call him. The basics of prostate cancer. What is prostate cancer? Prostate cancer happens when normal cells in the prostate gland change into abnormal cells and grow out of control. The prostate gland makes fluid that is part of semen. This gland sits below the bladder and in front of the rectum and forms a ring around the urethra, the tube that carries urine out of the body. Prostate cancer occurs most often in men older than 50. Although prostate cancer is very common, most men do not die from it. This is because prostate cancer usually grows very slowly. Prostate cancer has become the number one cancer in Nigerian men and constitutes 11% of all male cancers. What are the symptoms of prostate cancer? During the initial stages of prostate cancer, the person may not show any symptoms at all. When the symptoms start showing, they may resemble an enlarged prostate or BPH. Symptoms of prostate cancer may include frequent urination, decreased force in the urine stream, mild pain in the lower pelvic area, erectile dysfunction, blood in urine, hematuria, loss of appetite, loss of weight, bone pain. These symptoms can also be caused by conditions that are not prostate cancer, but if you have these symptoms, you should let your healthcare provider know. The differences between malignant and benign tumors in the prostate are as follows. Benign tumors. 1. There is no threat to the life of the person. 2. They rarely grow back once removed. 3. They don't invade the tissues around the prostate. 4. The tumor cells do not spread to other parts of the body. Cancerous tumors. 1. They may cause a threat to life in some cases. 2. They grow back sometimes, even after removal. 3. They invade the tissues and muscles around the prostate. 4. The cancer cells spread to other parts of the body. What are the risk factors for developing prostate cancer? Age. As the age goes up, the risk of developing prostate cancer increases, especially when men cross the age of 50 to 55. They are at higher risk than those who are in their 40s. Smoking. Smoking puts a person at double the risk of developing prostate cancer. Smokers who are diagnosed with prostate cancer have higher odds of dying of it. Being overweight. Maintaining a healthy weight not only helps in avoiding prostate cancer, but keeps away dozens of other diseases. Ethnicity. Black people are more likely to develop prostate cancer at an early stage. The cancer tumors grow even faster in these men compared to men of another ethnicity. Geographical area. Men living in Northern Europe and North America are at higher risk of dying of prostate cancer than those living in other parts of the world. Is there a test for prostate cancer? Yes. Healthcare providers use a blood test called a PSA test and an exam called a rectal exam to check for prostate cancer. In a rectal exam, your healthcare provider puts a finger in your anus and up into your rectum. He or she presses on the rectum wall to feel abnormal areas on the prostate. If your healthcare provider suspects you have prostate cancer, he or she will follow up with one or more tests. These can include ultrasound. The transrectal ultrasound technique is used to create a picture of the prostate using ultrasound waves. Prostate biopsy. A needle will be used to collect tissue samples from the prostate gland. The sample will then be tested for the presence of cancer cells. MRI fusion, a new technology that helps in biopsy and diagnosis of prostate. This technology is being used more and more every day. What is cancer staging? Cancer staging is a way in which specialists find out how far a cancer has spread. How is prostate cancer treated? Men with prostate cancer often have a choice of treatment. The main treatments for prostate cancer are active surveillance, Men who choose this option do not have treatment right away, but they do have routine tests to check whether the cancer starts to grow more quickly. If so, they can start active treatment then. Surgery. Prostate cancer can sometimes be treated with surgery to remove the prostate gland. Radiation therapy. Radiation kills cancer cells. Radiation can be given from a machine that moves around your body, or a doctor might put a source of radiation directly into the prostate gland. Hormone therapy. Male hormones in the body make prostate cancer grow. Hormone therapy reduces the levels of these hormones, which can shrink the cancer. For hormone therapy, men might take medicines, or they might have surgery to remove the testicles. Male hormones are made in the testicles. This treatment is usually only for men with advanced cancer. However, some men with early stage cancer get it along with radiation or surgery. Chemotherapy. Chemotherapy is the term doctors use to describe a group of medicines that kill cancer cells. Men with advanced prostate cancer might get chemotherapy if hormone therapy stops working. In some cases, chemotherapy and hormone therapy are given at the same time. Some men, especially older men with other serious medical conditions, might choose not to do any of the above. Instead, they might choose watchful waiting. Watchful waiting is not the same as active surveillance. It does not require regular testing, but involves treating symptoms when they happen. How do I choose which treatment to have? You and your doctor will have to work together to choose the right treatment for you. The right treatment will depend on the stage of your cancer, your age, whether you have other health problems, how you feel about the treatment options. Always let your doctors and nurses know how you feel about a treatment. Anytime you are offered a treatment, ask, what are the benefits of this treatment? Is it likely to help me live longer? Will it reduce or prevent symptoms? What are the downsides to this treatment? Are there other options besides this treatment? What happens if I do not have this treatment? What happens after treatment? After treatment, some men keep getting checked to see if the cancer comes back or starts growing more quickly. Other men choose not to be checked. Follow-up tests can include PSA tests, exams, biopsies, or imaging tests. What happens if the cancer comes back or spreads? If the cancer comes back, you might have more radiation therapy, surgery, or hormone therapy. You might also have chemotherapy. Chemotherapy is the term doctors use to describe a group of medicines that kill cancer cells. Can prostate cancer be prevented? Men who are at high risk of getting prostate cancer can sometimes take a medicine to help prevent the disease. If you have a family history of prostate cancer, talk to your doctor. 1. Nutritious diet including vegetables and fruits. 2. Maintaining proper body weight. Being overweight and obese puts you at a higher risk of prostate cancer. 3. Quit or avoid smoking. MKO Abimbola holds a doctoral degree in physician associate studies from the United States of America. He is a Harvard Medical School scholar. He specializes in internal medicine, acute care, emergency medicine, geriatrics, psychiatry, and surgical services. The Basics of Prostate Cancer is dedicated to the loving memory of the late Alhaji Imrain Abimbola, the father of Dr. MKO Abimbola. Alhaji Abimbola passed away on November 20th, 2006, after a prolonged battle with prostate cancer. He was a generous, philanthropic, and dedicated family man who valued education so much that he sent his children to private schools in the 70s when private schooling was perceived as a waste of money. Today, he has more than 50 children, grand and great-grandchildren who are bachelor's degree holders, at least. May his soul continue to rest in peace.